Suggestions for public healthcare. Public health care can be done by the power of citizens. Baek Jae-joong, director of Shincheon United Hospital, former representative of the Humanitarian Practice Council, looking back on the past time for the establishment of Songnam Citizens Medical Center, it is literally everything. It was a difficult process. Citizens played a role in the center until the opening of the hospital by creating ordinances with civic initiatives and taking the direction of the hospital. This is why the role of citizens should continue without stopping, even after the opening. In our society, medical publicity has been an agenda beyond interest. The reason may be found in the inadequacy of public health care in Korea, which eventually resulted from the indifference of the government and the people. In this reality, a major incident called the establishment of Songnam Citizens Medical Center by residents' initiative occurs. Songnam citizens achieved the great task of establishing Songnam Citizens Medical Center entirely with the power of citizens. It makes us realize what we need to do to expand and strengthen public health care. Both the government and parliament have less interest and will in public health than expected. The concept of public health care is poor, and there is no passion for expanding and strengthening public health care. Various public health policies have been introduced, but they have not functioned properly, and the results are disastrous. I think we need to think about how we can fundamentally change this situation. In the end, I think the residents' movement and civil society movement should come to the forefront. Looking at the achievements of Songnam citizens, the movement to establish public hospitals is becoming active across the country. Citizens' efforts to establish a public children's rehabilitation hospital are also being gathered. It is also the result of the urgency of allowing residents and citizens to step up their own efforts to expand and strengthen public health care. It is time for the central government and local governments to decide on bold support and investment in public health care in the right outlook. With residents' desire for public health boiling from below, the nation's medical supply system is in total chaos. Since Moon Jae-in care, the concentration of patients in the Big Five hospitals has been accelerating as the burden has decreased. There is no doctor, the medical delivery system is paralyzed, and patients are flocking to mega hospitals amid distrust in primary and secondary medical institutions. Local healthcare has long collapsed, and public healthcare has no presence. The huge private health sector is only chasing revenue. The bigger problem is that there is no power to recognize the situation and overcommit. In the end, I think the answer is for residents and citizens to come forward. There is not much to look forward to in the RALEN/SDR payroll with the government. If there was a will, there would have been some movement earlier. The most important thing in improving the healthcare supply system is the restoration of publicity. If public hospitals are expanded and reborn as a community-friendly hospital that is trusted in the region, I think it will pave the way for easing the concentration of super-large hospitals. The introduction of the doctor's system and the maintenance of the medical delivery system are also tasks that need to be combined. Songnam Citizens Medical Center started with the will and efforts of Songnam citizens, but it is necessary to seriously think about which public hospital to create. You can't leave it to local governments or hospital managers, or follow public hospitals in the past. We must now turn to evolution and innovation. In the past, public hospitals were recognized as hospitals used by vulnerable groups, such as poor people and homeless people who could not go to university, hospitals, or private hospitals. It was a gloomy and dark hospital. What went out a little bit here has expanded to hospitals that respond to public health crises, such as SARS, MERS, and COVID-19, which are in charge of essential medical care. That is difficult to do in the private sector due to lack of profitability. But here's why it shouldn't stop. This is because the needs of the residents and the needs of the citizens are overflowing. Above all, we hope that Songnam Citizens Medical Center will become a hospital without non-regular workers, a gender-equal hospital, and a disease SCOCI center that realizes workplace democracy. And I also look forward to community-friendly hospitals and citizen-friendly hospitals. In order to do so, I hope that citizens who have been striving to establish Songnam Citizens Medical Center can participate in the operation of the hospital in any way. and play a healthy role. Perhaps the participation of citizens will be a great help in creating a view of the hospital. I dream of an advanced hospital that can accommodate human rights issues within the hospital system and contain recent gender-related health issues within the hospital framework. A hospital that takes care of the health of the working people and does not turn a blind eye to the health problems of the minority and the weak is probably perfect as a new public hospital. If it is reborn as a wonderful public hospital, it will be a new hope for public health in Korea. I think Songnam Citizens Medical Center will be able to play that role. That's how much I look forward to it. Songnam citizens who agreed to establish Songnam Citizens Medical Center, proposed ordinances, and fully joined the establishment process, are the owners of Songnam Citizens Medical Center. I look forward to your future role as the owner of the hospital. Songnam Citizens Medical Center is a citizen for the first time, and also a citizen for the last time.